Over 800,000 people have heart attacks in the United States each year. Well, what if we told you there are steps to take to prevent being part of that statistic? Bush Cardiologist Dr. Lakshmi joins us in studio to explain how the average person can work toward preventing a heart attack.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are talking about preventing heart attacks with Dr. Lakshmi, coming all the way from Mattoon. Thank you for being here today.
Thank you very much, Lacey. It's a pleasure.
Of course. So you are being a new guest to the show. We like to get a little bit of a background just so our viewers at home can get to know a cardiologist that they might get to see. So if you could give us a little bit of background on who Dr. Lakshmi is.
Fantastic. I'm originally from India. I did medical school in India, and at the age of 24, I went to United Kingdom, and I did 3 years of residency in United Kingdom. And in 1992, I came to United States to Chicago. So I did residency, I repeated it, residency and fellowship in Chicago. And I finished the fellowship and came in 99 to Mattoon. That was my first job, lovers the first sight. And then 5 years I worked here and went to Champaign for about 15 years. And I'm back in 2020. They called me and said, we're going to restart the program here. Why don't you come and join us? My wife used to be a physician here too. She worked with Dr. Coleman's in the 2000s, and she's working in OSF in Champaign. Mm-hmm. I have one daughter who just finished master's in Georgetown, in foreign office in Georgetown, and looking for a job in New York. She tells me that I don't understand what a degree, so whatever it is. So I'm here and I'm having a great time in Mattoon. As you know, I know this place for a long time, and I have a lot of patients seeing me even when I went to Champaign. Mm-hmm. So it's like I have communication with this place, and a lot of nurses are good friends of mine, and many of nurses working here now still my old friends, so it worked out really great.
And I hear Sarah Bush Lincoln is very happy to have you back.
Fantastic.
So
for both of us.
We're talking today about preventing heart attacks. Now, I'd asked you prior to the show if you're able to prevent heart attacks, and you said 100%.
No, this is the most important thing. Actually, we have been struggling with this question. Why do people have heart attacks? Mm-hmm. You know, as a resident, as a physician, after I finished medical school, I didn't understand it. Most of the public and a lot of physicians think heart attacks are caused because of progressive narrowing of the coronary arteries. So there are patients or even doctors will come and say, I wish they had a cardiac cath in my dad 3 months back, because they would have found out that he had significant disease and saved him. It's wrong. It took me a long time to understand the answer to the question, why do people have heart attacks? The reason people, you guys are lucky to know the answer now, you're going to get it, is the plaque rupture, which means if you have done a cath on this guy about a month back, you would have had 50 or 60% disease and you wouldn't have done anything about it. So it's not caused by progressive narrowing as you would imagine. I would ask this as a quiz question whenever I go, what do you think this guy's, I will show a artery 100% occluded. About a month back, if I have done an angiogram, what do you think I would have seen? Most of them say 90%. It will be less than 60% blockage. I want you to understand that. So the vast majority of the heart attacks are caused by people who don't have significant blockage, but they rupture a plaque. And 100% occluded, you get this massive heart attack. We call STEMI, where you have to go to the hospital soon, and within 90 minutes, you have to do balloon or stent in those patients. So heart attacks are caused by plaque rupture, and you could prevent it because it happens in particular types of patients who have big plaques, people who are smokers, people who have high blood pressure, people who have genetic predisposition, people who are overweight and not able to exercise. So there are various factors, but I want you to know the crux of the matter is not a 90% blockage, which will occlude. It's that 50 to 60% blockage. And on Monday morning, when you pick up a fight with your spouse, or you're arguing about politics after an election, you rupture a plaque, boom, you get a heart attack. Does it make sense what I'm saying?
It might be a little more familiar for folks who have actually gone through it, but to me, I'm a little bit struggling with what is a plaque.
So plaque is a combination of inflammation and fat deposition in the coronary arteries. You know, we have coronary arteries which supply the heart muscle. Everywhere, there is blood supply to every part of the body. So when you have the heart muscle has got the blood supply from the coronary arteries, there are one artery in the right side and a big artery in the left, we divide it into two branches. Normally they're clean, squeaky clean when you're born. As we get older, we get deposits of fat and some inflammation. Like dental plaque, you get the plaque, but you can't floss it out. Mm-hmm. So these plaques became unstable because they get more cholesterol in it. And once they, at some point, they decide to rupture. And we still, as I said, we know why they rupture because of the high blood pressure, high heart rate, arguments, genetics, and so on and so forth. So these plaques will grow. The issue is you won't know that. Even if you do an angiogram, you will not see the plaque. So a lot of the patients would say at the age of 60, I had no symptoms. How did I get a heart attack? Because the first symptom is a heart attack. Mm-hmm. So you have to prevent it, and we'll go over it during this talk about it. Does it make sense what I'm saying?
Yeah. So then, I mean, let's start there.
So, you know, the two things happen. When the plaque rupture, if it's 100% occludes the artery, they get this massive heart attack. Those are the patients you see in the ER, sweaty and short of breath. A lot of these patients don't make it to the hospital. 50% of them who die in the heart attack, they die because the heart is erratic and irregular. So their heart will fibrillate, and then you have about 3 to 5 minutes to save them. So if you hear stories, many of them will say, we died in the sleep. Or they have a bowel movement, and the strain, or constipated or whatever it is, the strain ruptured the plaque, and they went into ventricular fibrillation. So they don't die because of the heart attack. It's secondary to heart attack, but that's because of an arrhythmia. So the only thing which will save is if you get in, resuscitate them within 3 to 5 minutes. Sometimes the family members can do a CPR until the ambulance arrives. So again, it's really hard to prevent it once they get the erratic heart rate unless you have support within the few minutes. That's why they die. Once they survive that, they come to the hospital and you put a balloon in. Then people who die because of congestive heart failure and weakness. But the initial death is caused by the ventricular arrhythmias, the erratic heart rate. And the only way that would be saved is if you have somebody who knows how to do CPR, and within 5 minutes the ambulance arrives and they start the resuscitation. So I want two things to clear. People get heart attack because of the plaque rupture, and we'll talk about prevention. They die because they develop an arrhythmia. Sometimes patients have a defibrillator, which is like a small refrigerator inside the chest, which is the defibrillator is inside your heart. That will defibrillate them from AFib, but we only put those for people who had previous heart attacks and they have weak heart muscles.
So the folks who, they haven't had any issues before, if they don't have that defibrillator in there, there's nothing to restart the car.
Correct. That's why. So the 50% of them, they're going to die in the heart attack, dies in first 5 to 10 minutes. And so that's all the more reason to prevent heart attacks in the first place. And that we're going to talk about it.
Yes, so I mean, you're talking about kind of all around it that we can prevent heart attacks. So let's dive right in. What is the best first thing someone can do?
So the most important thing is information, to know about it. Many folks who are extremely smart would not know anything about heart or the health because they're scared. It's like my dad is in India. He's very smart. He's 87, well-read, traveled around the world, but he doesn't want to know. If there's anything to do with the medicine, he says, I'll check with my son. I don't want to deal with that. So I think it's important to know information. So it starts with, what is your BMI, basic metabolic weight? What is your basic metabolic index? Normally, it's less than 25 is normal. I don't want to go into the details of it to know, okay, what's my BMI? What's my blood pressure? Everybody should have an idea. I'm not talking about a 20-year-old girl like Maggie, but once you're more than 40, you should know, what is your blood pressure? What is your cholesterol? And what is your blood sugar? These are some basic information you're supposed to know. I see many of them, they're like, I don't know what's my cholesterol. My doctor will know it. You have to know the information. Mm-hmm. Diet and exercise. We hear so much about it. I'm not an expert, but I'm just going to give some basic stuff. I tell diet, anything which you can chew is generally good. So what do we do whenever you're stressed? We have a donut or an ice cream which tastes good and immediately raises the blood sugar. You want to eat an apple or vegetables, a healthy diet, a salad. It takes time. You have to chew. That takes more time. So vegetables, salad, fruits, white meats, those are the type of food you want. There are a lot of details of it, but suffice to say, a lot more vegetables and fruits and salads and cut down the red meat. A lot of patients get really upset. That's all I eat. I tell people, if you're eating red meat every day, make it every week. If you're making every week, every 2 weeks. If you're doing every 2 weeks, once a month. So kind of cutting it down. Exercise is simply moving. If you're smart, if you're going to the gym, forget that. But most of them ask me, I said, if you're a walker, just walk for 30 to 45 minutes. If you're a swimmer, the same thing. Moving is good. But the most important thing I tell about exercise, this is another secret today. The weight loss has nothing to do with exercise. 90% of the weight loss is related to the diet. But exercise will stabilize the weight, but make you feel good, which is important. Everybody, when you go to the gym, you look at the mirror 5 times, even though nothing has changed, if you notice it, particularly guys. So diet, exercise, knowing the numbers. Now, the real important thing which we can do recently is something called coronary artery calcium score. Now, I told you plaques will develop from the age of 20 or 30. So patients who are having extensive disease at the age of 60 probably started when you're 20 or 30. And you want to know, if I do a stress test, a lot of patients will say, I had a stress test which was normal, doctor. The stress test is only abnormal if you have more than 80% blockage. That's why we put balloon or stent. But suppose you have a 30 or 40% disease, the exercise stress test will be normal. Does it mean you don't have coronary disease? No, it means there's no critical blockage. But I told you plaque rupture happens in less than 60% disease. So the coronary artery produces calcium as a repair mechanism. I almost describe as microscopic heart attacks are happening all the time in these patients. So small you can't see it. The body produces calcium as an adaptive response, as a repair mechanism. This has nothing to do with the calcium you take. Patients ask this, can I take calcium, doctor? This has nothing to do with the calcium. So the body produces calcium. Suppose you are 40 or 50 years old and you do this, we can do a CT scan. It takes about 2 minutes to do the CT. If your calcium score is 0, that means you have minimal atherosclerosis. That doesn't mean you'll never have a heart attack, but you can smile. Okay, it's not bad. Between 0 to 100 is kind of mild to moderate. 100 to 400 calcium score is moderate. And if the calcium score is more than 400 or 1,000, that means you have extensive atherosclerosis. Now, we know that when you have extensive calcium, the risk of heart attack is increased. The risk of dying with heart attack is increased. Doesn't mean you panic, but at least you understand the information.
That knowledge.
Knowledge. So let's say you have a family history of coronary disease. 2-3 members of the family have died of a heart attack. They will come to me at 40 or 45. I'll tell, okay, let's do a coronary artery calcium score. If it's 0, I said, okay, we don't need to be too aggressive, but at least you still need to diet and exercise. And
it's not a free pass.
It's not a free pass, but if your calcium score is 500 or 1,000, I would aggressively treat them. We know that if the LDL cholesterol, which is the bad cholesterol, is really low, less than 70, the risk of heart attack substantially goes down. But all drugs come with some side effects. You're going to put them on drugs to get them down. There are lots of new drugs. We have fantastic drugs to keep the cholesterol down. We can eliminate coronary artery disease entirely from the world. There is enough drugs to do that if you have the right patients and the right medical care and the right system. So calcium score is the best way in addition to this, because if it is 0, it's really, really low. If it's 1,000, it's really high risk. So you know where you stand. So that is what I would recommend for patients with intermediate risk. Of course, if somebody is 25 years old, they're running marathon, they have everybody in their family lived up to 1,000 years. I'm exaggerating, but they don't need to undergo any test. But a lot of these patients between the age of 40 and 60 have risk factors, and they're walking around in the community. And I said, every heart attack, you missed the boat. It's a failure on the part of all of us. Every man's death diminishes me, one of the famous poems says, because I'm involved in mankind. So we are going to lose every time we have a heart attack. Yeah, in the hospital we take good care of them, but we missed an opportunity to stop it. Because if I know his calcium score is high, if I know his blood pressure is high, if I know his blood sugar is high, I would have aggressively treated him. And I told you 100%, it's 99.99%, there's nothing is 100%, but do you get that point?
Well, and it's important to realize that getting that annual wellness check with your doctor is so important to catch something early. What age would you maybe recommend if I've got heart disease in the family?
So in general, I used to say men after 40, women after 50, assuming there is no significant risk factors. But there are exceptions. Imagine about 4 or 5 members of the family died of a heart attack in young. There is a strong genetic predisposition because we are still learning about the genes. So I think if you have multiple, like for example, cancers, I tell them, you can do a mammogram. It's typically start at 40, right? But if you have 3 members of the family who had breast cancer, I'll start at 30. So, but generally 40 in men and 50 in women is what? Because women are partially protected by the hormones and they start about 10 years later. I'm talking about average. But more importantly, we do that test at Sarah Bush Hospital now, this calcium score, and they are doing extremely well. What they do is, at the moment, the insurance are not paying for this calcium score test, but they do for, I think, $100, correct me if I'm wrong, for not only that they look at the carotids and they do like fasting lipids and a bunch of other tests. And they will give you the printout result and tell you what to do. So I think it is a very nice, many hospitals are charging a lot and they're not doing it. I mean, I have every week a phone call from somewhere in the United States or in the world, because I have all these friends, how to prevent it. This is the question they're calling me, and nobody has done a calcium score. And 4 friends or family members have died in the last year with a heart attack in my family. And two of them are doctors from the United States. One is trained by me in Chicago and is a bodybuilder. Another was in Florida, is an internist. My point is, we somehow assume that it's not going to come to us. I bet if you go to Sarah Bush and ask about 90% of the doctors or nurses, they would say, oh, I haven't checked it because I'm feeling good. Because that doesn't tell you whether you have plaque or not, and you don't know what's your calcium score.
It's that rupture, and it'll just sneak up on you.
Exactly. And that's why you were surprised. There are a lot of famous personalities. One of Supreme Court judge just died a few years back. He went to sleep, never woke up. The famous NBC, Tim Russert. Apparently he had a stress test. Tim Russert, I know, is very famous. And he just dropped dead about 10, 15 years back. And these are not poor people. That's the point I'm saying. I mean, there is information out there if you can only get those information.
And so I believe it's called a heart-to-heart test.
Correct.
I've actually had one, and I found it very interesting just to get that inside look. I've got heart disease in my family. I do carry some extra weight, things of that nature. So it was very eye-opening.
Fantastic.
Well, thank you so much. Knocked out 40 pounds prior to recording.
Nice.
Not that I'm bragging. So anyways, as we are talking about possibly wanting to get one of these. Is this a conversation I have with my primary care physician if I'm concerned, or will the doctor bring it up to me maybe?
I think we are trying to educate more primary care physicians. I think many of the Sarah Bush guys knows about it, but you should discuss with the primary care physician, particularly, as I said, if you have risk factors. I mean, you could do everything perfect and still things can go wrong. And that's the reason why if you have risk factors, you should bring it up to the primary care physician and say heart to heart. I try to do that conversation with many of my patients who refer to me. They have normal stress test. And I'll say, have you ever had and I'll be surprised sometimes. One of the physician who comes from Champaign to see me, my old friend, is a tennis player, extremely agile and looks really good. He was 70. I said, let's do a calcium score. It was 2,500. I thought it's going to be normal. Anyway, he had no symptoms. I put him on statins. We get the cholesterol as low as possible, right medications and monitor. The point is, outward look can be deceiving, and particularly if you have risk factors, please discuss with your physician. And as I said, once you go on the right medicine, it prevents the heart attack substantially close to 100%, and even if they do have heart problem, it's not severe. Does it make sense? If the patients who are on appropriate medications, even if they get one or two problems, the heart attacks, they'll be milder and they'll get better soon. It also prevents a lot of these medicines, strokes and arrhythmias as well. So they're all connected to each other.
Definitely. And so as we're talking about preventing heart attacks, how important is it also to pay attention to, like you said, the blood pressure and cholesterol and making sure you're checking these things often?
Absolutely true. The blood pressure, and we can talk for hours, but I want to do this. The normal blood pressure is 120/80. So those days we used to say, oh, the age plus 80, it's okay if they're 90 years old, blood pressure at 160 is okay. No. Your blood pressure is normal, you rarely get strokes. In my experience of more than 30 years, I'm getting old, I have rarely seen patients who have normal blood pressure and stroke. And also normal blood pressure prevents dementia. A lot of this dementia happens because they get small strokes called lacunar strokes. These strokes happen in the front of the brain. That's where your imagination and behavioral patterns. So a lot of these elderly guys, they're all acting weird. People say, oh, the old man is crazy. No, they were having multiple strokes because they had high blood pressure over the years and not treated. So normal blood pressure also prevents biological aging because the arteries get stiff as we get older. And if you can keep the pliable, the blood pressure is the pressure of the walls, the blood on the walls. And if you keep your blood pressure normal, you don't age. I'm talking about vascular aging, not the outward look. But again, so normal blood pressure means almost no stroke, prevents aging, prevents dementia. So you got to check your blood pressure and get it right. Now, blood sugar. There are lots of good medicines that have come recently to keep the blood sugar down without major side effects. They're actually beneficial, preventing heart attacks and preventing congestive heart failure. So talk to the doctor, and the normal A1C should be, A1C is the average of blood sugar over 3 months, should be less than 6.5. If you've never checked it, check your A1C, particularly if you think a lot of our blood sugars and fasting blood sugar more than 125 is diabetes. Between 100 and 125 we call pre-diabetes. So you could check the A1C, and if it's more than 6.5, you're diabetic. Doesn't mean you need to need medicine. You could do exercise and stuff like that. So I will check. And then cholesterol, you should at least check it every adult after they have 20 or 25. Every 5 years, I'll check the cholesterol. This is for patients who have no problem with that. Every 5 years as an adult, check your blood cholesterol to see where you stand. So it'll give an idea. We talked about body mass index. There are a lot of people argue if you're muscular, it can be high, but if it's less than 30, that 24 is what the definition between 26 and 29 is obese, and more than 30 to 40 is obese, and more than 40 is morbidly obese. But my suggestion is you want to know where you are and be honest about yourself. I think most of us are scared, and we just somehow think that it's going to disappear, either it's blood sugar or overweight. They don't want to talk about it. Mm-hmm. I think if you're honest about it, discuss with your doctor about it, and anxiety, which has actually gotten worse over the last few years in this pandemic, people are anxious to discuss about a lot of things to the doctors. So I think if you establish a good communication with the doctor and talk about it, it's been much more beneficial to doctors, and we have so many things to offer.
Well, and it's funny that you bring up anxiety because I was going to ask about it in our last couple of minutes here, managing stress externally, internally. How important is that? Like you said, I mean, it could just be the fight with the spouse heading out the door, but that could be the nail in the coffin.
It's absolutely, and then we looked at this data. Patients who are depressed more likely to get heart attack, and when they have heart attack, they're depressed, and nobody talks to them about it. There are so many psychosocial issues with that. Relationship with the wife or husband after heart attack, romance. So many people are scared after bypass surgery about relationships. I think it's become a taboo to discuss this thing with doctors. I think we need to change the culture where you feel comfortable discussing with the doctor. Our patients who have erectile dysfunction, they need to talk about medications with it because it's important to have good relationship with your spouse, particularly with heart disease. Anxiety and stress are the most important thing, particularly in the last few years. As I said, in America, doctors, probably nurses and doctors, are probably the worst affected because they're under so much stress they don't want to talk about it. Mm-hmm. Because it's a taboo to discuss anxiety with anybody. You know, we grew up in a culture where you have to be manly or womanly, which means you don't discuss your personal problems. Stress and anxiety are the main reason. A lot of us are talking about now yoga, meditation. It's become, meditation has really become so famous. I started doing meditation in the last 2 years. I do 12 minutes in the afternoon and 12 minutes at night, where you sit down quietly, and I do it in the office between 12:45 and 1. I think these are you don't need to be particular type of meditation. For you, the meditation is watching TikTok. I mean, you know, that's what my nurse say. Or maybe relaxing, or maybe going for a walk, or listening to Simon and Garfunkel, or whatever new music you have. So I think, and these are things we should promote, even in work. We should give more 10 or 15 minutes where people have this kind of relaxation classes, and every year to discuss with your physician about it, about the issues, various issues. So I think all of them will make a tremendous change. We have the technology. The question is, are we using it?
That's a very good question, Dr. Lakshmi. Well, we're out of time for this episode, but a lot of great information. Thank you for coming on today.
Thank you very much. It was a pleasure, Lacey.
You're so welcome, and we can't wait to see our viewers for our next episode of Being Well, so we'll see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.